Well, thank you for inviting us to speak. I spoke to the first speaker from this morning at coffee time, and I said I was going to pinch one of his bullet points that he used on one of his slides to introduce myself. One of the bullet points was working at the coalface, and I'd just like to say I'm one of the miners at the coalface. My name's Val Dimmock. I'm employed by Homerton University Hospital, and I'm the Simulation and Clinical Skills Facilitator there. I'm a nurse by background, and I specialised in A&E, now ED, and critical care, and have got my educational degree and worked in university for several years. Then I came back to the NHS with the sole aim of bringing education theory to practice, which is always the big argument that people say, theory up in the ivory tower and practice down here. It's always been one of my passions to try and bring them together. So I arrived at Homerton in 2008, and they had funding to develop a purpose-built simulation and clinical skills centre within the already thriving education centre that they've got there at the moment. And we are now happily up and running and have been since 2010. So that's my background. The key thing about Homerton is that they actually have support from executive level down. So our chief executive and our chief nurse are committed to education, as is our medical director, and we very much focus our education and training around team training, and so we bring all the professions together in terms of delivering the education. So what we're looking at now at the moment is the challenges that we now have post-Francis. We're looking at potential solutions, one of which we hope we've come up with by working in partnership with Elsevier at the moment. So the vision. We're a thriving hospital. We were the Olympic hospital in 2012. Hopefully most of our patients are quite happy. Our patient survey and staff survey tells us that patients, staff are happy, and that's just a view of our education centre, the lecture theatre that we have there. Our vision is to improve patient safety and improve the quality of care delivery. One of the things, the committees that we have in place is a patient safety committee that actually meets weekly. And they review all the incidents that have occurred, and there's been lots of talk this morning about incidents that happen and there's no feedback. They're reviewed weekly, and the impact that has is an action plan, dare I say it, that has a huge impact on education and practice. And we are empowered, I like to think, by the powers that be to actually deliver that. So what we wanted to do was look at the right systems and the right processes that we could put in place in order to deliver that. Because sometimes the recommendations come down from this committee and say, provide the training for all staff in the hospital. Well, that's quite a tall feat when you've got one thing that you're going to deliver. So, challenges post-Francis. We all know of all the problems, and I'm not going to dwell on this because a lot of people have been talking about some of these this morning. The training demands that we have that are put upon us nationally as well as locally are about provision of care which is under ever increasing scrutiny by the public domain. And there's ambitious training targets that are in line with the CQC. The reality of all of this is that we work in a time-pressured environment. We have an increased number of duties that we have to perform. Within the team, that's doctors, nurses, the lady alluded to earlier, the porters, the cleaners, everyone is a member of the team. And there's an increasing number of duties being put upon us. There's challenges of teaching on the wards. So one of the things that I want to try and improve for myself is to make myself more visible in the ward environment, not just for the staff, but for the patients. But on top of that, we also have financial constraints around training. So, at Homerton, what I did when I first came in 2008 was we did a needs analysis to look at the demands of what the training was required in terms of clinical skills teaching, competency assessment for all levels of staff. When we look at the staff and the people that go through the organisation, we've got over 3,000 staff. We have 600 medical students per year, 70 plus student nurses, 50 plus student midwives, 30 plus allied health professionals, and we have multiple sites within the trust that we have to manage. So, solutions. Clinical skills training, the standard setup, put on a study day, deliver the training, staff come to the classroom. Simulation, we now have our brand new simulation centre. One of the things we've tried to introduce within that is to actually encourage team training. So an example I'll use is our endoscopy team. So when we do training in endoscopy care, we have the doctors, the nurses, the technicians, and they work together looking at how the team functions together. So what we're doing is we're addressing technical as well as non-technical issues. Human factors is the term which will be common to a lot of you. However, another solution that has come to light now that we're working in partnership with Elsevier is a blended learning application to practice. So we can actually have people doing some of the learning before they actually come to the study day, and so they can actually concentrate on the things that they feel is relevant to them. So some of the feedback that we had when we were delivering training is there's never enough time for the practical element because you have to deliver the theory as well. And so now with this new learning online system, what we can do is get them to do the theoretical online learning before with a test component, which I'll take you through in a moment. And they bring that to the session so we can concentrate specifically on the practical side of the clinical skill. It will also give me more time then to supervise them and go out into the clinical practice area when they're actually undertaking the skill. So, let's just have a look at it. It's an online learning system, but what it does, it allows not only new learning to take place, but it allows renewing that learning, updating on both clinical, practical and communication skills. So this is just a view of it. And as you can see, there are several components. There's a quick sheet that tells staff what the skill is all about. There's a checklist, so it gives them a checklist that what equipment they need to undertake the skill, a list of the equipment they need, and there's a demonstration on all of these applications, so they can actually watch it as well. They can self-test, and then we have a skill overview as well. So there's lots of information that staff can access at the coalface, in the ward, at the time that they need to do the skill. So if it's something that you're rusty on, that you haven't done for 6 months and you just want to recap before you actually undertake the care for your patient, you can pull all of this off. You can also use it for performance review. So ward managers are very excited about it in terms of they are going to manage their group of staff. They are going to allocate skills that they want them to learn, which is specific for their ward areas or their community areas. They can track them. They can see whether they've passed the test. They can see how many times it took them to undertake the test in order to pass it. And they've got information that they can pull off and keep for appraisal purposes, so it's going to cover clinical governance aspects as well. So in terms of results, what we hope it's going to do is to improve quality care delivery. So again, it's about admitting, if I haven't done something for 6 months, I'm a bit rusty, I'm going to read up on about it before I do anything. So I'm going to make sure that I know exactly what is in my head and what I've got to do before I go and see the patient. I'm hoping it's going to reduce time out of clinical practice. So rather than a full day study day, they can undertake the online learning, come to a 2-hour session in the education centre to undertake the practical element with the evidence that they've undertaken the learning. And then I can follow up. It gives me more time to follow them up and supervise them in practice. When I have gone out onto the wards to supervise staff, I've spoken to patients, and from the patient perspective, is they are really excited to actually see that this learning and this supervision is actually taking place, because if you make it transparent and visible to them, they feel that what they're telling me is that they actually feel more confident in the staff that are caring for them. It's up-to-date information. There is an editorial board, so all the information is reviewed regularly and it's updated. The contributors are all professionals, academics, qualified nurses, etc. And we're hoping, with the managers using it for appraisals and for performance review, it's going to contribute to CQC requirements. So all the data that's collected on it can be pulled off, exported in different formats, and it gives you hard data as well as soft data, which is evidence for the CQC visits when they come round on the visits. That's just a view of one of the video demonstrations. So not only will it ensure consistent high levels of care throughout our services, it's also going to provide transparent, demonstrable data, soft and hard, to internal and external regulators. And hopefully it's going to help us address some of those things that have been raised within the Francis report. Thank you.